Ethical Perspectives on the News is produced by the Interreligious Council of Lynn County, which is solely responsible for its content. The views and opinions expressed on this program do not necessarily reflect those of the staff and management of KCRG TV9.
Good morning and welcome to Ethical Perspectives on the News. My name is Al Fisher. I will be serving as the moderator of today's program, which is entitled The Future of Healthcare, although we're going to be focusing more specifically for much of the broadcast on the future of the Affordable Health Care Act, more popularly known as Obamacare. Thank you for joining us. One of the most critical ethical issues that has faced Americans is whether being able to pay for the health care that one needs is a right, like public education, or like military defense, or like clean air or water, or whether it is a consumer commodity to be purchased if one can afford it or if one has health insurance. For over a century now, both Republican and Democratic politicians in the United States have been advocating some form of universal health insurance. The United States is the only post-industrial society in the world that does not provide universal health insurance for all of its citizens. On the Republican side, dating from the days of Teddy Roosevelt up through Richard Nixon, some of whose health care proposals bear striking resemblance to Obamacare, to Mitt Romney, and on the Democratic side, Harry Truman, Lyndon Johnson, and Bill Clinton and Jimmy Carter. The Affordable Health Care Act, which was passed in 2010 by Congress under the Obama administration, has probably come the closest to providing Americans with some form of universal insurance. More than 20 million persons have health insurance today than did before the passage of Obamacare. The percentage of the percentage of uninsured has dropped from 17% to about 11% today. However, the Republicans in Congress and Donald Trump during his presidential campaign vowed to repeal and replace the Affordable Health Care Act. And just within the last 24 hours, the first couple of plans have emerged from congressional committees for a Republican plan to replace Obamacare. So during the broadcast today, we're going to ask what some of the main features of the Affordable Health Care Act have been, what some of the more positive consequences stemming from it have been, what some of the problems have been, what some of the changes have been that are now being recommended, what political chances those have of being enacted, and what their consequences might be. So we have today, for addressing these questions, first Dr. Mary Kemen, who is an anesthesiologist in Cedar Rapids, particularly at St. Luke's Hospital. Dr. Ghirantan Ghosh, who is an oncologist in Cedar Rapids at the Ghosh Center, and Dr. Becky Benson, who is a pediatrician at the University of Iowa Hospitals and Clinics. So let's begin with the question of what some of the main provisions of the Affordable Health Care Act have been, and what you regard as some of the more significant consequences of the Affordable Health Care Act, either positive or negative, or some of both.
Well, I think first of all, the point to make is what you already said. I do believe that basic health care is a right, and that it should be a right for any country. Certainly the wealthiest nation in the world should be able to provide that to its citizens. And so I think it's a real problem when we allow millions of people to be without health care. And there is a huge difference between President Trump's stating that he will provide access to care, because everyone does have access to care, but whether or not they can afford to tap into that access is really the issue. So when you look at some of the facts and you realize what you said, that now millions of people have care that the Republican plan would take away from them, that's a problem. If we look at the statistic of longevity in the United States, we are ranked 42nd in the world in terms of lifetime expectancy. So we already rank behind 41 other nations in terms of how long we will live, and I think that's a direct consequence of the lack of care. What Obamacare provided was equal care for men and women. Women couldn't be charged more. It decreased the number of uninsured children by 50%. It provided access to pregnancy care through Medicaid programs. It, on average, decreased the pharmacy bill of people on Medicare by $2,000 a year in 2016. And another fact to look at is that in 2016, 74% of employed people had no access to health care through their employer. So there's a huge need.
Dr. Ghosh?
I need to step in because I think that everybody must have a good health for the country to survive. And to have a good health is just not insurance. Mm-hmm. The prevention, I think it should start with the education of the kids. Mm-hmm. Education of the diet, what we are feeding to the kids. Obesity has become a major issue in this country, including the pediatric population, and it has a lot to do with we are adding salt and sugar and we are feeding the kids. So we need to prevent. We got to prevent, because if you look at these, the healthcare costs, the way it is going up, even the European countries or Canada who provides healthcare, they also restrict a lot of access to new drugs. I'm talking about cancer drug. We are approving cancer drug because they have a 4 weeks prolongation of survival. It costs $100,000. So we really need to have a good handle on the cost, but I do think that we are not strong in prevention. I think we need to educate the kids, we need to educate the teachers and parents. I am surprised that how little we know what we eat. I mean, I am very active educating my staff and patients. I go to the school, I talked about that. I'm just going to give you an example. I went to a Boy Scout meeting, and I was looking around, all of them are obese, most of them. And there were children who came and got a Mountain Dew, and that has 78 grams of sugar. He does not know that his 24 allowance is 28 grams of sugar. So at the end of the day, the kids are getting 100 grams, 120 grams of sugar. So we need to look at whole things, just not the insurance premium. And I will say that Obamacare has done a great job. And even the things that they have proposed, they are respecting the greatness of the Obamacare. And they are, to me, that the premium of a sick person and not sick person are going to be same. They are not taking away the lifetime cap. I have seen people in my life, young men who had cancer before the Obamacare, and they lost the insurance, and not knowing, I was at the beginning of my life, I used to say, you have COBRA, but the premium of the COBRA is, so I will say that I'm thankful that he's not taking those out. The only thing he's talking about how we are going to fund. And I will tell you that there needs to be discussion how we are going to fund and how we are going to take care of it. I think we need to emphasize more so that we don't get any disease. We know science-wise, like we are coming up with a better treatment, 70% of the illness is preventable. We need to emphasize on that.
Well, as a pediatrician, I will certainly also say that I think prevention is key and is very important, and perhaps needs to be reimbursed differently, because those of us in primary care oftentimes struggle with getting reimbursed for the preventative care that we are providing and the counseling about obesity and other matters. So I think there are certainly some things that we can improve overall in healthcare. I think the coverage for pre-existing conditions is one of the very important things that needs to stay as a part of our healthcare mandate, because we can't justify treating people differently just because they have illnesses or conditions that we already know about. I think that insurance companies shouldn't be able to discriminate against them. But there are a lot of things that I think people wonder about. Will they stay or will they go? Another thing for pediatrics that has been very helpful for us is the concurrent care provision that allows children with serious illnesses like cancers or that may be terminal or life-limiting to get hospice care if they qualify, along with the ongoing care that they may need to live well at home or to potentially treat a treatable condition. That's something that we're certainly hoping will stay in.
Maybe I have not made my point clear. I just want to make sure we prevent the illness. I want the prevention starting in the first day that the kids walks to the school. I want school to provide them a better healthy diet. I want to educate the parents the harmfulness of all the food products that we are buying. I want to emphasize on that. I don't think we have emphasized that part. I mean, we want to prevent the people getting sick. That also needs to be part of the healthcare, just not insurance reimbursement.
Mm-hmm. And I agree with that completely. We really have fallen very far in terms of allowing our food sourcing to be so maligned that we don't really eat the foods that we should. People have very little knowledge of nutrition in the United States. One thing that President Trump has mentioned that would be very helpful would be controlling pharmaceutical costs. We've never done it, and every other country does that as well. So I would like to see us move towards a national healthcare system, more based like a Canada or in England, in which you have a framework of nationalized healthcare. You can control costs because the government has the right to do that. In our country, Medicare is that version, but it only starts at 65, and Medicare does not have the right to control pharmaceutical costs. So there's a huge difference between our systems.
Two things I want to talk about. One is that will you accept a restriction of certain drugs?
Yes, I would.
I think that is
would.
important part of the controlling the cost. In cancer care, I can tell you that every new drug FBI approves, which is scientifically has a p-value meaningful, but real life meaningful is not there. So in European country, they don't allow that. Mm-hmm. I mean, so that we as a whole, as a society, needs to understand that if we have to have a viable system, financial viable system, there needs to be value of care. And, the Medicaid, which is state-run program, they can buy the drug directly from the pharmaceutical company. Medicare is not allowed to do that. CMS is asking years after years. Now, part of the Obamacare bill was so that CMS can buy the drug or ask for pricing from different companies. 100% Republican voted against it, and majority of Democrat voted against it. So I have a question to them. Why they are supporting the middleman who is doing nothing but taking most of the profit out? I have a debate whether pharmaceutical companies should make that much money or not. That's a different discussion. But I cannot understand that in United States, the state has the right to buy the drug directly from Medicaid, and Medicare do not have that right. And that will decrease a lot of costs right off the bat. And this is time for the people to focus on that and pressurize both leaders. And I have not heard from President Trump. I heard one. I said, my God, he's making some sense in terms of controlling the cost, but there is no further discussion on that.
There isn't. That is correct.
No plan as of yet.
There are a couple of changes that were proposed in the Republican plans yesterday that I think warrant a discussion, because I think they could undo some of the achievements of Obamacare. One is the doing away with the mandate for people to have insurance, because it seems to me it is hard for me to see how a jerry-rigged program like Obamacare could work effectively if healthier people, or people who believe they are healthier, do not have to participate and help to subsidize. Also, the taxes on wealthier Americans that have been subsidizing poorer Americans through the Affordable Health Care Act would be done away with. But also, the Medicaid expansion, I think, has been a very important part of Obamacare, and it looks to me by 2020 as though that will be more or less effectively gone. If it is converted to a kind of block grant program, that leads states to a kind of race to the bottom. So I think that is potentially troubling. That is, I don't think that many of the mechanisms in Obamacare that have made it possible for more than 20 million people to get insurance are going to survive.
Well, and I think the problem with that, when you say that you will freeze Medicaid, so now you're assuming that no further people will need to join the Medicaid ranks.
Right.
And it's hard to say that when we have, for instance, a national minimum wage of $7.25 an hour, a state minimum wage of $7.25 an hour, and when we know the largest employer in our nation, Walmart, has in its employee handbook that you should apply for Medicaid right away. That's one of their suggestions when they hire on. So there are a lot of people who will still need Medicaid. The expansion of Medicaid has brought maternity care to patients. It's brought increased treatment of narcotic addiction, which is of course rampant in many parts of our country now. It's brought greater mental health treatment. There are a lot of hospitals that were able to expand their mental health programs. And so if we take all of that away, by taking away the expansion from 10 million people, where does that leave them? Where does that leave these critically necessary issues? Iowa has a real mental health problem right now, and we have had our funding cut, we've had facilities closed, so we have a desperate need for Medicaid money for mental health.
Dr. Ghosh? Yeah.
I can take the side either way. I don't know which side I want to take. I think you are exactly right. The proposal is to hurt the poor people. They will lose the healthcare access. The proposal is going to make the rich people more benefited. No question on that. But I think that, but this is also true. The studies have shown with the Obamacare, if you make so much money, you are entitled to Medicaid or get some break. And if you make another $10 more, you lose it. So people had disincentive not to work. And that was also wrong, because we want to support everyone. Everybody needs to participate and be a productive citizen. And that incentive was wrong.
Yet when you look at Medicaid, 74% of people last year who received Medicaid had a full-time employee in their household, and 11% more had a part-time employee. So that concept that people on Medicaid are unemployed is actually somewhat misleading. Many of the people on Medicaid are employed, or many of them want to work full-time, but they work for a company that will not give them full-time employment. So, you know, and the fact is still, even if people have lesser employment, knowing what the job situation is in this country, how do we still deny them health care?
You know, this always has been the debate by the two mindset. It's hard to win one over other, but I will say that good Obamacare is going to stay. One is that the premium is going to be same for poor, for the sick or not, and you cannot discriminate, you cannot exclude the pre-existing conditions. That was a fantastic thing that Obama did. And the other is, you know, Mary, you know that we have been profiled already from 2018 will be graded good or bad doctor, the data that we provided. I think there is a argument whether that's right or wrong, but I think that may be a way to control the cost, because you want to You want to reward the physician who is doing a good job. This is a very complex issue. It's hard to open discussion on any subject in half an hour.
Right.
But I think I will tell you the CBO has showed that from 2012 to 2015, the rules that we had, that if the patient comes in the hospital without bed sore or Foley catheter infection, those are preventable infection, and that infection has been prevented, and 55,000 lives has been saved, and 268 million has been saved. I'm glad that the new proposal is not taking those away. So,
I'm not nearly so sanguine as you are about the Republican proposals, though, because they will take away large parts of the subsidies that poor people have been receiving and replace them with tax credits. And one of the more bizarre features, I think, of these two plans is that tax credits will be based solely on age and not on income. So I think that the subsidies being replaced by tax credits skews the stratification of healthcare in the wrong direction.
so there are, I'm sorry, go ahead.
Go ahead.
Well, I was going to say, so people like my brother, who has worked as a teacher's aide and as a Goodwill coach, he has needed subsidy to help him buy insurance. And I think he would be tempted to not buy insurance because he sees himself as very healthy. But when he did have a health care issue, the fact that he had insurance to help get him through that became critically important. And I think for the younger generation, many of them think, I'm never going to get sick, or I won't need this until I'm older. But it's not until you have, some event that suddenly makes you realize how much you could otherwise, be spending on healthcare without, and of course we all know that large insurance companies and the government can barter with the healthcare system and pay about, a third of what we are actually charging to somebody who doesn't have healthcare insurance. So I think the fact that, some of these skews will be in the system might disincentivize younger people from getting insurance until they feel like they're older and might need it or have a job that covers it.
So there are two parts. One is the Medicaid, and other is non-Medicaid, people work. Now, Obamacare required that everybody should buy the health insurance. 7.5 million people paying penalty in 2014. So they did not buy it in spite of the law. And with the current proposal, the people who will not buy the insurance, if they want to buy the insurance, there is going to be 30% penalty of the premium. So there is going to be a penalty. So Republican side is saying that's the way we are going to incentivize to buy the policy, because if they want to buy the policy, there will be surcharge. Is that going to be enough for the people to motivate to buy the health insurance? Because healthier population has to buy the health insurance. And I think you are right. The older, poorer is really going to get hurt because the tax credit, let's say if you have, as it has been discussed, if you have a person who is 60-year-old, lives in Nebraska and has $20,000 income, with the current Obamacare, she was getting $18,000 subsidies. But with the Republican Party, is going to be up to $4,000 because, and one of the things that they changed the rules recently is that they had capped up to $150,000. You will not get any subsidies. Otherwise, our Secretary of State, who is a multi-billionaire, if he was in the free market, he would have got $4,000, and this person in Nebraska would have got $4,000. That is not right. That is not fair. And I think we need to deal with that. But I don't think it's going to go anywhere because 4 Republican senators has said, we don't like it, what you have done, and they cannot afford to lose more than 2 senators. So I don't know where it's going to go.
That leads me to the next question, and that is, how do you think this is going to play out politically? What would you see as the most desirable outcome? What do you see as the most likely outcome?
I think it's going to be very divisive, and I think One reason is already the staunch Republicans who feel this isn't drastic enough have already spoken up. They want no subsidies, no tax break for someone, whether it be $2,000 for a 28-year-old or $4,000 for a 60-year-old. And again, we have to ask ourselves why we are the only, as you put it, post-industrial nation that does not supply a basic framework of health care to every citizen, and why we are willing to have the 42nd worst, best, however you wish to put it, longevity behind 41 other countries. So I think it's going to be a long time before this is really resolved to satisfaction. And I think one thing that tells us that is the town hall meetings. People are very upset at town hall meetings, and rightfully so. I heard an analysis the other day that pointed out now that so many people have Obamacare, they actually have health coverage for the first time in their lives for some of them. They can't imagine not having it. In Kentucky, they said they've gotten dental work done, they've had basic surgeries done. They've had basic health care that they never had any access to. And so now they realize what that means, how much that improves their lives. And the other thing is when you look at financial analyses, people's finances are better because they aren't putting so much money into their health care. They now can put money into other things that they need in their lives. So.
Well, I certainly think we can all agree that we hope that people speak out and speak to their elected officials and tell them what's important to them about the health care that they've been receiving, what they want to see in the future. I think that's one of the most important things we can encourage people to do, is to speak out about what they've enjoyed about, Obamacare, how that's helped them, what changes they see as being helpful or not helpful. I think that's one of the best things that can come out of this discussion, is just more people speaking up.
I will say that don't get sick. Everyone can do a whole lot to take care of their health. Don't drink, don't smoke, eat right, exercise, don't get sick, because we can debate and everything else. I don't know where we are going to go, but don't get sick. And I think we have an obligation, the healthcare professional, to nail down in the head, please don't get sick. And the science is saying 70% of the health illnesses in United States is preventable.
It also seems to me a couple of you have mentioned end-of-life issues, and it seems to me that we need to give much more attention, much more encouragement from physicians to patients to think about end-of-life issues, about having a living will, about having a power of attorney for health care, and about the conditions under which one wants to be kept alive. I have a good friend who has been on a feeding tube now for 5 years. She cannot speak. She is never out of bed and so forth. That seems to me highly irrational, and if there's anything we can do as a society to encourage people to make plans in advance, that would be very helpful. So, any closing statements from any of you? Thank you for your very informed comments.
It's a very difficult subject to talk in half an hour, because each part could go any direction. But I will say Obama will be remembered doing an excellent health care. The replace or repeal is just how we are going to fund. The core work that has been done to improve the health care will stay. How we are going to get paid has changed, whether we like it or not, from 2018, and nobody is going to touch that too.
Thank you very much for joining us this morning on Ethical Perspectives on the News.